Welcome back to the Orthopedic Show on Dr. Radio. I'm your host, Dr. Guillaume Lomas, and we're talking knee injuries, hip injuries. We're talking reasons for hip pain, knee pain, including obesity. And if you have any questions about any of this, if you're just curious or bored or excited, give us a call. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. You can email us too at docs, D-O-C-S, at SiriusXM.com. And I'm thrilled to introduce our next guest. I think this is really something that needs to be addressed whenever we talk about hip and knee pain and arthritis. I'm talking about Dr. Felicia Stoller. And Dr. Stoller is a registered dietitian, an exercise physiologist, and a fellow of the American College of Sports Medicine. She's also an author and former host of the show, Honey, We're Killing the Kids. Dr. Stoller, welcome to Dr. Radio.
My pleasure. Thank you. You could certainly do better and make better for you food choices. Making sure, again, you're having adequate nutrients in your diet. So as far as joint health and nutrition, I can speak more about bone health and nutrition because I think there's a little bit more there from a food standpoint and a nutrient standpoint. What would you say?
Yeah, no, I would agree. I mean, I think we do know that there are probably some foods that are, look, inflammation is inflammation, and there are probably some foods that don't contribute to decreasing inflammation.
Right.
And I would concur with what you were saying about foods that are really natural, things that you can find in the environment that you don't have to pull out a dictionary to pronounce, unless they're Indonesian or from Australia. But yeah, I mean, it's I think it just gets down to eating natural things that are easily digested and that don't make the body work very hard.
Right. I mean, so in terms of inflammation, the things that we think about, we look at phytochemicals and plant pigments in foods. The other thing is looking at essential fatty acids, right? And looking, we hear a lot about eating fish oil. Some other things to consider would be something called tocotrienols, which is a form of vitamin E that is found in something like Malaysian palm fruit oil. We hear a lot about tropical oils, so we know there's a lot of popularity both with, for example, palm oil and also with coconut oil. So we're looking at how those fats are beneficial. For the longest time, we told people not to eat them, but we're looking at, wow, there are some other added health benefits. So I think it's really important to consider the types of foods that you eat because you don't have to just say like let's look at if you eat fat you are fat, it's like you are what you eat, but you can make better for you food choices, right? Looking at